Hello friends, I am Sonia John, working as Assistant Professor in Bayani Institute of Science and Management. On behalf of Guru KPO, today I am going to deliver a lecture on convulsive disorder or seizure disorder. So, while explaining about the convulsive disorder or seizure disorder, first we see the broad concerns, that is some of the broad concerns regarding seizures. So, first we will discuss about convulsions. Convulsions are involuntary contractions of the voluntary muscles. That means the involuntary contraction, that without knowingly the contractions occurs of the voluntary muscles. Second one is seizures. Seizures are abnormal jerking movements of the muscles, and we can also there say that all seizures are not epileptic. Next we move on to the third part, that is epilepsy. Epilepsy, it is the type of seizure, or it is characterized by seizure in which there is a malfunctioning of the brain's electrical system. In epilepsy, there will be malfunctioning of the brain's electrical system. Next one is status epilepticus. It is a type of epilepsy, or it is a severe form of epilepsy in which the child will not have any time between two subsequent attacks. That is, before getting recovery from the first attack, the child will subsequently have another attack. So, the child will not get even the time to recover from the first attack. So, these are the broad concerns while I am explaining regarding the seizure disorder. Now, I will explain about, or I will define the seizure. Seizures are defined as abnormal discharges from the brain's electrical system, which is manifested as jerking movements of the extremity with loss of consciousness. Seizures are abnormal, that is discharges from the brain, abnormal discharges from the brain which are manifested, that is which shows the clinical manifestation or which shows the signs of such as jerking movements of the extremities as well as with loss of consciousness. Next we move on to the causes. What are the causes of convulsive disorder or seizure disorder? So, some of the causes of seizure disorder are, first one is, it is multifactorial. Multifactorial means that is if we see, there are many factors which can lead to seizure disorder. Second one is genetic predisposition, that is genetic factor. Second one is alteration in electrolyte levels. We have got hypocalcemia, hypermagnesemia, hyperphosphatemia. These, if like this, if the alterations there occur, then what will happen? Because of these alterations, the brain's electrical system gets disturbed and it will malfunction. Second one, fourth one is infections like meningitis and encephalitis. Meningitis is infections which the outer covering of the brain, that is meninges, and because of these infections like meningitis and encephalitis, the child will have convulsive disorder or seizure disorder. Next is space occupying lesions. Space occupying lesions means if the child have any tumor or presence of any lesions, because of that the child can also manifest convulsive disorder or seizure disorder. Next we move on to the pathophysiology, how the disease progresses in the body or how it spreads from, like these are the causative factors and how it spreads. So, first we will see, in the brain there are a group of hyperexcitable neurons. We know we have got hyperexcitable neurons, we have got neuron cells, and these cells provide impulses to our body. So, in brain there are a group of hyperexcitable neurons and these are called as epilepticogenic foci, and these neurons or hyperexcitable cells are known as epilepticogenic foci. and as a result of that, what happens, these cells get stimulated with any of the etiological factors. We have seen most of the causes or etiological factors, and it can be stimulated by any of the etiological factors, and which can lead to, this leads to the discharge of the abnormal electrical impulses. As a result of that, what happens, these cells are getting stimulated. As the cells are getting stimulated, they can cause discharges of abnormal electrical impulses, that the electrical impulses will be abnormal. So, as a result of coming of this abnormal electrical impulses, what happens, then it will lead to, this will be transmitted across the neurons and also to the peripheral nervous system. So, when this abnormal discharges are impulse or abnormal impulses are spreading, so what will happen, these abnormal impulses will transmit across the neurons and also to the peripheral nervous system, and as a result of that, what will happen, there will be abnormal jerking movements. Once again, I will explain the pathophysiology. In the brain, there are a group of hyperexcitable neurons. In the brain, there are hyperexcitable neurons, and these are called as epilepticogenic foci, and these epileptico foci get cells, these cells get stimulated by any of the etiological factor, and because of that, what happens, there will be discharges of the abnormal electrical impulses, and these impulses will then again transmit across the neurons and the peripheral nervous system, and because of that, there will be abnormal jerking movements. Next, we move on to the clinical manifestations. What are the clinical features, or what are the clinical manifestation, or otherwise we can say what are the signs and symptoms of convulsive disorder. So, in generalized seizures, there are two phases, that is tonic phase and clonic phase. In tonic phase, the duration time is 10 to 20 seconds, that is the duration time is 10 to 20 seconds. And in tonic phase, what happens, the child will have the duration time will be 10 to 20 seconds, the child's eyes will roll upwards, there will be the child's head and neck will be hyperextended, and the hands will be flexed. Next, if we see to the clinical manifestations, there will be loss of consciousness, and along with that, there will be the child will have excessive salivation and excessive frothing around the mouth. And if we see to the clonic phase, second one is the clonic phase. Clonic phase is which lasts for 30 seconds or more, that is clonic phase which lasts for 30 seconds or more. In clonic phase, what happens, the child will have loss of consciousness, and there will be violent jerking movements along with loss of consciousness. The child will manifest violent jerking movements with loss of consciousness, and the child will give a piercing cry. And the second one is, in second case only, what happens, the child may urinate or defecate, and there will be excessive frothing around the mouth. So, these are the two phases, and both of the phases I am explained, that is in tonic phase it lasts for 10 to 20 seconds, and in clonic phase it lasts for 30 seconds or more. Next, we move on to the diagnostic evaluation. The diagnostic evaluation, we know firstly we will collect the history from the child or child's parents. So, first of all we will collect the history from the and second one we will do EEG. EEG means electroencephalogram, and the nurses have two aspects of responsibility while doing the EEG. So, first responsibility is that if the child has to be sent for EEG, the nurse should ask her parents, ask the child's parents to shampoo his hair, his or her hair. Why? Because why we are shampooing the hair means, that is if oil will be present in the hair, then what will happen, the electrodes will not get impulses properly. So, it can interfere with the electrodes impulses. So, because of that, what we are doing, we are asking the parents to shampoo the hair of the child. And the second aspect is that the child should be sedated before doing the EEG procedure. First we have collected the history, second EEG, and the third step is we will assess the serum electrolytes levels to see whether there is any abnormality in the electrolyte levels. To assess that, we are doing serum electrolyte level test. And the fourth one is CT scan or MRI. CT scan or MRI we are doing to analyze whether any type of space occupying lesions or any type of tumor is present. For detecting that, we are doing CT scan or MRI. So, today we have discussed about the convulsive disorder. We have seen the broad concerns while explaining regarding the seizure disorder. In that, we have seen they are convulsions, seizures, epilepsy, status epilepticus, and then we have seen the definition of seizures, that it is defined as the abnormal discharges from the brain's electrical system, which is manifested as jerking movements of the extremities with loss of consciousness. Next, we move on to the causes. Causes also we have seen, it is multifactorial. There is genetic predisposition, alteration in the electrolyte levels, infections like meningitis and encephalitis, and space occupying lesions such as tumors, etc. Then we have seen the pathophysiology, clinical manifestations. Clinical manifestation I have discussed, there are two phases, that is tonic phase and conic phase. And next we have seen about the diagnostic evaluation. So, today we have discussed regarding the definition, causes, pathophysiology, clinical manifestation, diagnostic evaluation of the convulsive disorder or seizure disorder. Thanks for watching this video. Please like, comment, share our YouTube channel.